A cut, a nick, or even an abrasion in the foot of a diabetic may quickly become infected and develop gangrene. When this happens, the only solution may be to amputate. 73,000 diabetic feet are amputated each year in the United States. In Europe, between 290,000 and 450,000 diabetic feet are amputated each year. A diabetes-related amputation is performed once every 20 seconds somewhere in the world. VOTIS helps diabetics keep their feet. We screen for peripheral vascular disease and infection and help the healthcare provider to diagnose and monitor their scope and severity. We gather information entirely non-invasively. We transmit the captured information via the cloud to remote sensors for analysis and classification according to objective standardized criteria. Then we automatically create a dynamic 3D model of tissues and arteries in the foot. After analysis, the processed information is transmitted back into the patient's electronic medical records. Access to this information can significantly reduce amputation rates by enabling healthcare providers to utilize a range of less drastic treatment options that may not be available if the disease progresses. These options include encouraging the patient to wear special shoes and stop smoking, prescribing certain medications, and performing angioplasty or vascular surgery. Separate studies in Germany and Italy each demonstrated that early detection, coupled with introducing the appropriate therapy, can reduce the need for amputation by more than 70%. Identifying foot pathology early enables disease modification and alters outcome, saving diabetics' feet. In addition to diagnosis and monitoring, VOTIS can play a key preventative role by screening for peripheral vascular disease before tangible symptoms arise. Organizations, including the American Diabetes Association, the American Heart Association, the American College of Cardiology, and the International Working Group on the Diabetic Foot, all have recommended annual screening of the foot for peripheral vascular disease for diabetics who are 50 or older, or who are younger and have had diabetes for more than 10 years. Yet current technologies are not sufficient. VOTIS fills this need. VOTIS is lightweight, portable, and inexpensive. It's radiation-free and does not require use of contrast agents. As a digital health system, it transmits data over the cloud and uses heuristics and deep learning for data analysis. This prototype was built as a single unit, including the data intake component, the computer where the collected data is analyzed, and the graphical user interface. In the prototype, data is collected in this box. In the commercial product, the hardware will be reduced to a boot-like element, a single piece of non-capital equipment used only to gather data. This boot-like element eliminates all ambient light. During the procedure, the patient places his or her foot into an impermeable, sterile, single-use disposable sheath and gently rests it on a thick piece of glass for a 5-minute procedure. The foot is encircled by photodiodes and photodetectors that transmit infrared and near-infrared light into the foot sequentially and at specific frequencies. For this demonstration video, the prototype device was filmed in open light. The collected data is sent over the cloud to remote, HIPAA-compliant Amazon servers for analysis by artificial intelligence machine learning. By measuring scattering and absorption of the light, VOTIS calculates oxyhemoglobin and deoxyhemoglobin content and uses this information to assess the condition of the foot. Here we see reconstructed three-dimensional maps of the foot generated by VOTIS. One of these maps shows a normal foot, and the other shows a foot with signs of peripheral vascular disease. The difference in the blood flow in the arteries of the foot is stark. VOTIS is designed to be inexpensive and suitable for use all over the world, including in lower and middle-income countries, as well as the West. Tests will be billed per use on a software-as-a-service basis. VOTIS is suitable for use by trained technicians in a hospital, or the office of a primary care physician, in a mobile clinic, at home, or in a retirement community or nursing home, and in specialized diabetes or wound care medical centers. The VOTIS technology was developed at Columbia University in New York City. 4 patents already have been issued, and 6 other patent applications are pending. All of the intellectual properties being licensed to VOTIS by Columbia University on an exclusive worldwide basis. And Professor Andreas Hielscher of Columbia, who invented the technology, continues to advise the company on its development. In addition to Professor Hielscher, VOTIS benefits from input by advisors including Dr. David Armstrong of USC, perhaps the leading expert in the diabetic foot; Dr. Jonathan Rosenblum, who is former head of diabetic foot service at Shaarei Tzedek Medical Center in Jerusalem, Israel; and Steve Epstein, a distinguished engineer at Cisco Systems, who is guiding VOTIS's cloud and AI strategy. The VOTIS device was developed with the generous support of more than $3 million in grant funding from the U.S. National Institutes of Health and others. Prototypes already have been tested successfully on more than 100 patients. Besides releasing the VOTIS system in leading European countries and the UK and in the US, we plan to make India the focus of our strategy to reach developing nations. There are more diabetes sufferers in India than in any other country in the world outside of China, and for this reason VOTIS was selected as one of just 6 healthcare companies, 18 startup companies in all, to accompany Prime Minister Netanyahu to India in January. Together with Apollo Hospitals, the leading hospital chain in India, VOTIS plans to conduct a clinical study this summer to measure the ability of the device to identify infection in the feet of diabetic patients. We plan to use results of this study to refine the system as necessary. With funding in hand, we hope to introduce VOTIS into the Indian market by early 2019 and to launch the product in the European market later next year. VOTIS is a breakthrough technology. It represents a new standard of excellence in screening, diagnosing, and monitoring disease in the diabetic foot. Early diagnosis saves feet, and with VOTIS, the healthcare provider is able to help diabetics keep their feet and save money, limbs, and lives.